Good evening, everybody. Hello, I am Dr. Tamara McCants, and this is Pharmacy for the People, your information resource to help you to take care of your health and your loved ones in simple language that you can understand. So, I wonder if you all noticed that I was not on last week. I did not go live and provide any information because I was at the annual American Pharmacists Association conference, spending lots of quality time with the members of the National Pharmaceutical Association. And I'm so excited to have been able to be with my colleagues live and in person since 2 years. It has been 2 years. So I usually go to that conference every single year, and I had a great time. And so during that conference, I was asked to do a presentation about how to increase collaboration between the health systems pharmacists or the hospital pharmacists and the community pharmacists. And so while I was doing that presentation or preparing for that presentation, I realized that this is a topic that I need to tell Pharmacy for the People about. And it is about something that we hope that we don't ever have to experience, but that so many of us have already. And that is going to the hospital. So what I want to talk to you tonight is about how do you survive your hospital visit? And I'm talking about one, when you should determine when it's time for you to go to the hospital. Two, if you are admitted, then what you should bring with you. And three, how do you prepare for your discharge so that you are not readmitted back into the hospital? So if you're like me, I hate hospitals. I had 2 children, and every time it was time for me to go into labor, I dreaded going into the hospital. It's just something about the hospital that gives me so much anxiety and so much fear. And I know that most people of color, that we don't even like the hospital. We don't like going to the doctor. We don't like engaging in health systems. We just don't like to do that. It's not a comfortable place for us. And to be honest with you, it is really the reason why so many of us actually died from COVID, because we will be feeling really bad and just staying at home trying to tough it out, calling our mother, calling our grandmother, calling our sister or somebody like, oh, I don't really feel that good, and not doing anything about it. And if you were with me a few weeks ago when I was talking about a heart attack, a lot of times it doesn't just come on suddenly. It is sometimes days of you just not feeling well, and then a person experiences a heart attack. So the first thing I want to talk to you about is, how do you identify if you or your loved one is in a medical emergency? And when I say a medical emergency, it means that it is time to go to the emergency room. And so now I know that we have like these urgent care centers or even some standalone emergency rooms. But the standalone emergency rooms and the urgent care centers is not what I'm talking about today. I'm talking about, when should you go to the hospital, because you're going to need some type of acute medical intervention in order for you to save your life. And so when you determine that it's time for you to go to hospital, it's just a few symptoms. And these symptoms are life threatening. A lot of times we walk around, we're suffering in silence, again, toughening out, trying to see it through, trying to see if we could skate by. But I'm here to let you know that if you are experiencing any of these symptoms, you or your loved one, that it is time to go to the hospital. If you are living alone, then that means that you call the ambulance so that you can go to the emergency room. If you are living with someone, then you ask them to take you to the hospital. Or if you are witnessing someone having these symptoms, then it's time for them to go to the hospital. So some of these symptoms include shortness of breath, chest or stomach pain or pressure, fainting or dizziness. Even if it happens to you all the time, you still should go to the hospital to get checked on. Changes in vision. So meaning that you're sitting here right now and then all of a sudden your vision gets a little blurry, or you can't really see that well, or you have to squint, or it gets fuzzy. That can be a sign of a stroke, and it's time for you to go to the hospital. If you have any changes in your speech or difficulty speaking, it's time for you to go to the hospital. If you feel any type of confusion or change in mental status, or if you see somebody where they're just all of a sudden very confused, don't know where they are, it's time to go to the hospital. If you feel like you want to kill somebody or kill yourself, harm yourself or somebody else, then it's time for you to go to the hospital. If somebody expresses that, it's time for them to go to the hospital. If you have sudden or severe pain where you're doubled over in pain, don't take a Tylenol, don't take an Advil. It's time for you to go to the hospital. If you have uncontrolled bleeding, meaning that you cut your finger and it still hadn't stopped after you wrapped it up and held it up and everything, it's time to go to the hospital. If you have persistent vomiting and diarrhea, it is time to go to the hospital. And last but not least, if you are coughing or vomiting blood, that's not something that you want to see, okay, let me see if I can feel better. It is time to go to the hospital. And the reason why I am encouraging people to go to the hospital at the first signs of these symptoms is because the time that you experience these symptoms and the time that you get the intervention that you need at the hospital can literally be the difference between life and death. And the thing about a full service hospital is that it has equipment, it has medications, it has all of the life-saving equipment that you will need in order for you to save your life. And so once you get to the hospital, and it is actually a 50 chance that what you're experiencing wasn't really life-threatening, and they send you home. And so that would be good if they do send you home. But sometimes you have to advocate for yourself and really make sure that you're able to explain your symptoms, because they may try to send you home before you should go home. So you want to sometimes be very persistent about having them look into you, or give you a full workup, and or be clear about, I feel like I need some medical intervention. So if you have the medical intervention and it is determined that something life-threatening is happening and they need to stabilize you before you go home, then you will get admitted to the hospital. Now, at the point when they admit you at the hospital, the first thing that you want to do is call a loved one or let someone know that you are going to be admitted to the hospital. And when you are admitted to the hospital, you want to make sure that you have your full medication regimen. If you're on any medication, you want to have all of those bottles with you. You also want to bring any paperwork that you have pertaining to your health for anything that you may be treated for, because with that information, then the hospital and the doctors, nurses, and pharmacists there are able to give you the right kind of treatment. So while you may not have brought all of your medications with you in a rush to get to the hospital, you want to make sure you bring all of your medications with you, or you get that information to the hospital as quickly as possible so that they can know what medications you're on, and that you can know, they can know how to treat you. The other thing that you want to know, or you want to make sure is very clearly communicated once you're admitted to the hospital, is who is your power of attorney, or who is making decisions on your behalf. And so that person also, what you're going to have to do is determine whether or not you want to be resuscitated or not. If unfortunately you have a cold or your heart stopped beating or you stop breathing, do you want to be resuscitated? You want to have somebody that is there that can really advocate for your health on your behalf and may really advocate for your care. And that person to be your voice when you're not there, if you're unable to speak. So, but most of the times, because we are listening to this talk right now, you are knowing that you have to go to the hospital when you first experience the symptoms. So it's more likely that you're going to get discharged from the hospital. Some of the key words that you want to use to make sure that you're being looked at thoroughly is one, asking to see if the doctor has seen you. Asking the doctor or a medical professional, is there any lab work that needs to be done to confirm that everything is okay? Asking the doctor or the other medical professional if they had a chance to review your medications to know if there are any drug interactions or if you're experiencing an adverse reaction. The other thing that I also want to encourage you to do is a lot of times, depending on where you're going, you may be at a hospital where it's a medical student or a medical resident or somebody like that. And I'm not saying, it's good to have those people seeing after you, they're learning, etc. But sometimes they miss stuff. So you always want to see if you can speak to the charge nurse or the attending physician. The charge nurse or the attending physician is the person is in charge, probably the most senior member and the person that's going to have the most medical knowledge to make sure that nothing has been missed. So, you listened to me tonight. You, at the first symptom, you went to the doctor, you went to the hospital, you went to the emergency room, they admitted you. So they admitted you. And so the role of the hospital is to stabilize you, to provide you with acute care so that you can be discharged. So everything worked out. You were stabilized, you are being discharged. So I want to talk to you about how do you successfully discharge and how do you successfully discharge your loved one? One, the first thing that you want to make sure that you have is the written instructions that the medical professional is given to you. And I mean, this could be a provider, a physician, a nurse practitioner, the nurse, whatever you're being discharged with, you want all of the paperwork. You want all of the written paperwork for the discharge. Ask for a copy of your labs. Ask for a copy of all medications that you were provided, because you want to take all of that information to your primary care provider or your doctor outside of the hospital that you regularly see, or if you don't have a primary care provider, somebody that you will start regularly seeing so that they can take care of you in the long term so you won't have to go to the hospital again. So ask for printouts of all of your information. The second thing that you want to know is, am I being provided any medications? What medications is being provided for me? And somebody, preferably a pharmacist, should come and talk to you at your bedside about the medications that you are being discharged with. And you should ask at that time, can I get those prescriptions sent to my neighborhood pharmacy? So know what pharmacy you want to send your prescriptions to. Or is there any way those prescriptions can be filled and brought to me on my bedside? Because that's the most convenient service, is for the hospital to provide you with your discharge medications before you leave the hospital. Now, the hospital can't package medication for you to take outside. So that's why it has to be filled with a community pharmacy. So the hospital usually can partner with a community pharmacy to provide discharge medications, and or the next best thing is for them to send it to the pharmacy that you usually go to that can deliver the medications to your home, or that you can stop and get on your way out. I know we don't like to talk about hospitalizations. We don't like to talk about being severely sick. We don't like to talk about medical emergencies. But the more that we talk about it, the more healthy we can be, the more that we can take care of ourselves and our loved ones, and the more quality of life we can have. So health information is what you need to keep you informed so you can take care of yourselves and your loved ones. Thank you so much for joining tonight, and you have a good evening.